طيب بسم الله الرحمن الرحيم. Welcome everybody to our session. Sorry for delay. But I hope inshallah it will be a very interesting session. Despite the disappointment and the upsetting situation for the delay or for the closure of the applications in a few minutes. Yes, so many doctors have been accepted and they succeed for the applications. Congratulations for their seats, and I hope them all the best and hope they will pass. And for those who are waiting, we are here to discuss this issue. First of all, I don't want anyone to be disappointed from their waste. There is no waste. Study is an investment. It is not a loss. And you will get benefit from it in other exams, number one, in your practice, in your interviews, in this exam if you got a seat. And sooner or later you will get a seat. But the other rule, don't stick to one line if it is delayed. يعني شنو؟ Choose the exam which will help you in career destinations. If there is any delay, another suitable opportunity will arise. يعني تلقى فرصة ثانية. طيب يعني do not be attached to one exam. You can do many things while waiting for this exam. طيب what is the plan B? According to my experience with other exams, MRCP, MRCGB, MRChem, we will discuss quickly the difference between MRCGB, International South Asia, and MRCGB, Muhammad bin Rashid University in Dubai, which is same, accredited by the Royal College of General Practitioners, and the MRCP for the medicine, and the other boards like AMC, for example. طيب المايكات يا جماعة، تفضل المايكات عشان ما نقدر نطلع ونرجع ثاني. طيب دي مقارنة سريعة ما بين الام ار سي جي بي انترناشونال دبي والام ار سي جي بي ساوث ايشيا. طيب الام ار سي جي بي دبي الفرق شنو؟ What is the difference? The difference انه the Dubai version there is 3 exams. Part 1 MCQ same like the AKT, and there is another one, it's called MEQ. The MEQ is same like a short note. For example, they will give you a case scenario, a very long scenario, And then they will ask you, same like clinical exam, the OSCE exam, but here in written. Instead of you are talking to the patient or the SB or talking to the examiner, here you are talking to the paper, you are writing. For example, a patient with a headache, which is very severe and came for the first time, a thunderclap headache, and the patient is 60 years old, came with neck stiffness, and blah, 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 is telling about a headache of secondary headache like suspected subarachnoid hemorrhage. So what is your right 5 differential diagnosis, and what is the top of the differential? Give me the 4 steps in the emergency medicine, emergency department. What are the complications? List 4 or 5 complications. Like that. So in one scenario, there will be 4 or 5 questions in a short note. طبعا this is يعني most doctors, most people, they don't like these kinds of questions because it will test you, real test. It's not like MCQs you will select. يعني ممكن تجاسف حتى لو ما عارف. لا هنا بتكتب براسك. You will write. The third one, which is if you can see here in the screen,
تمام.
the OSCE.
ده رأيت الروضة اللي رأيتكم شنو اللي رأيه الروضة؟
Mike, Dr. Mike.
بعدين شوية دكتور
Sorry. What is the difference between the two? The difference is that the only difference, this Dubai, it's very easy to apply. Same like MRCGP International South Asia before 2 years ago. The application will be open for 1 month. They will send it by courier, by DHL, and everybody will get a seat. Sometimes people will withdraw, but because they are not ready. What happens? The Australia. The BAB busway in Australia for the small towns and the rurals, they accept the MRCGP International South Asia, the Pakistan one, the difficult to apply one, this one, as alternative pathway or workplace competency pathway. Yani you will go with the MRCGP membership. You will start working, and after 1 year, they will assess you like an oral exam, which is not very difficult. And then they will give you RCGP Australia. This pathway is far better in outcome and income and from the AMC pathway, the standard pathway. People sit for the AMC1, AMC2 is very difficult to get a visa for Australia. And the OSCE exam, very costly. So, and at the same time, you will start like house officer or medical officers, and the salaries are not that much. The jobs are not very available. But with the MRCGP International South Asia, the pathway is easy, fast, and very, very high income. That is why our colleagues from Pakistan, from India, from other parts of the world, from Arab countries, so they rush to it. And the number of the candidates applying for the exam is, they are not ready for it. Even their website is a very poor website. Yani what our engineer said about this website, you cannot imagine that is a website for a membership authorities like MRCGB International. Very poor website. Because they were not expecting. طيب. Why the MRCGB Dubai version is not famous? Because the benefit of it is only in the Gulf area. Yani it can, with some experience, the documents, your document will be evaluated in MOH or DOH like in UAE or in the Saudian authorities. It will be evaluated and you can upgrade to specialist. It is a very powerful line in the CV for family medicine jobs, for general practitioner jobs, in a hospitals, in a clinics, wherever. And in UAE, the Dubai version is higher than the South Asia version because it's more difficult. طبعا maybe same like the Pakistan one was not accepted by Australia. Maybe it will get authorization or acceptance. And if it is accepted, then even those who got this membership and years ago, they will get the benefit. طيب. What is the good thing in the Dubai version? Dubai version, you can apply easy, online, all the paper online, the payment online, very good website. And at the same time, you can sit for the AKT and MEQ and OSCE exam in 1 week. And you can do OSCE before the MEQ. You can do the MEQ before the AKT. Whatever you want to do, do. There is no order. يعني ممكن الواحد يمتحن العملي قبل الAKT. ممكن يمتحن الAKT قبل الMEQ. ممكن عادة بيكون السنة اللي فاتت والسنين اللي قبلها كلها عادة بيكون the AKT today, the MEQ 2 days after, and the OSCE 5 days after. So if you are ready, you can do all of them, penalties, shoot, and class. Congratulations. Type, yes, very expensive. Maybe double the cost of the exam of the South Asia. But as I told you, a little there is extra paper and extra payment, but you can do all together in 1 week. The first part, easy to apply. You can get a seat easily. The second part, the MEQ easily. OSCE exam, there is queue, but not much. Yani people they are getting. Right. When the exam will be held, the coming date, usually they have two dates. One in March, April, May, and one in October. Okay, last one in May, yani not held because of the war. I think, yani, The second one, on October, we are waiting. I contact them, and it is not yet determined, but you can apply. The form is open. The form is open. The form, you can apply or not. This is not the application form, the final application form. But this is when you will register your email and interest, and immediately when they open it officially, they will send you email notification that the application is open and you can apply the the final exam form. And easy, it will be open for 2 months or 3 months. They will collect all the application and then they will review. طيب في حاجة مهمة جدا تاني إنه they will not accept anything other than general practitioner in primary care or doing primary care or family medicine in name in the certificate. They are very restrictive. يعني لازم يكون شغال في family medicine أو primary care clinic. جيب general practitioner من hospital, general practitioner in medicine, general practitioner in nephrology, general practitioner in the home care. They will not accept. طيب هل بيعدل لأخصائي؟ يس. ناس عدلت به وفي ناس معانا شغالين به family medicine department. Same everything. It is in the Royal College of UK. نفس القيمة، بل بالعكس لوكالي مغيم أعلى من ساوث آسيا لوكالي. طيب هل مسألة الترخيص دي، مسألة التعديل الأبجريد ده حاجة فيها فيكس رول؟ ما فيها فيكس رول. After you got the membership and you have 1 or 2 years or 3 years experience, 3 years is the best. You will take your experience certificate and your membership and you will submit it to the committee. The committee will see your experience, where you work, and then they will give you the appointment for exam. Sometimes oral exam, sometimes barometric exam or volumetric exam or MCQs. There is no fixed rule, but they are upgrading. People upgrading it with it. خلاصة موضوع دبي، تقديم سهل، امتحانات الثلاثة في 1 week للجاهز. الابلكيشنز اونلاين كلها اغلى شويه، ممكن تكلف حوالي 15,000 او حاجه زي دي درهم.
Excuse me, doctor. I'm really sorry to ask, but please could you explain in English? We can't understand
sorry.
Arabic.
Sorry. Yes, it is a little expensive and application is very restricted to family medicine practitioners or primary care working doctors. They are not expecting you bring any general practitioner. They will ask you details. Okay. Eligibility, same eligibility, 3 years. Okay. طيب, there is website. I share it with you. There is website. You can go directly write in Google MRCGB International Muhammad bin Rashid MBUR MBRU. Okay, just MRCGB International Dubai Mohammed bin Rashid University application form. Just straight away from Google's Chrome, they will direct you to the form. You can go to the website directly. There is all the information you need. Okay, eligibility, fees, everything is there. طيب هل في difference في الماتيريالز؟ No difference. Same MCQ is the same like MCQ of South Asia. Everything is copy paste, is the same. Everything your study. عشان كده why we are comparing this today يا جماعة. You can with this and those who are studying or already they are did a very hard job and prepare themselves for the MRCGB International South Asia exam, AKT. With this study, with this preparation, you can sit for Dubai exam. You can sit for MRCP, part 1, part 2 exam with this preparation. I will show you at the end of this, I will give you 5 questions. Today we should discuss in our course. Actually, today was booked for multiple sclerosis, the demyelination disorders, all the demyelination disorders, central nervous system demyelination, the multiple sclerosis and neuromyelitis optica, and the peripheral and peripheral nervous demyelination disorders, Guillain-Barré, CIDP, and the others, demyelination disorders, hereditary or infectious or others. I will show you 5 questions. MRCGB, AKT, Dubai or South Asia, and then the same 5 questions modified to MRCP, medicine, and the same question are modified to AMC, Australian guidelines. There is no big difference. No difference between MRCGB and MRCP, the medicine and the family medicine. There is no difference in the AKT, in the family medicine exam, and part 1, part 2 in MRCP, UK or Ireland. Same with this preparation, you can sit for this exam while waiting for the Pakistan exam. So you will be relaxed. You already have membership in medicine, for example. Or if you are not intending or interested in Australia, you can. This Dubai exam is more than enough because same authorities, same everything. Okay, like exam materials, same like wherever you are preparing for the MRCGB AKT exam, same like for. Okay, what you need if you want to sit for Dubai exam, you need the MEQ. You need to prepare a little change in preparations. عادة الناس for MCQs is a little bit easier. لكن to write a note or a short point, still people they don't. I don't like it. لكن it is not that much. You need a little preparations, so you can memorize how to write instead of taking MCQs. You can just write a point. It is not like a long essay. No, it is just point. For example, we need a 5 differential. A patient presented to you with a chest pain, which is his patient known case of diabetes type 2 on amlodipine, and he's having GERD, gastroesophageal reflux disease, and at the same time he's having hiatus hernia, or he's having he's taking some medications, steroids, for example, or non-steroidal anti-inflammatory, and he came with epigastric pain and burning sensation, 60, 70 years old with diabetes. So what is your possible differentials. So you will put it whatever the list. What is the most likely differential? What the initial investigations in orders, and this patient came to you with sweaty and like that, like put for us 5 steps in management. This is a style of the MAQ. OSCE is the same, everything is same. With like the South Asia. Right. What is the difference for the MRCP medicine? MRCP medicine will help you to upgrade yourself to internal medicine specialist, and we have a lot of doctors who upgrade their license and their career, their designations in the hospitals with the MRCP. We have one colleague who just now 1 month ago he upgraded himself. Need 3 years maximum, or 3 years preferably experience in medicine, or even in emergency medicine, whatever. So there is exam, a barometric exam for some doctors, according to the committee, and oral exam for some doctors. And the other benefit of the MRCP, the medicine, which is not the case in MRCGB, the MRCP, the medicine, you can got a license, the registration in the GMC in UK or in Ireland. Okay. Even you can get a training job. And I have a lot of my colleagues, they got a training job directly, not a service job, training line. Neurology, immunology, infectious, toxicologies, whatever. Especially available are the critical cares and acute medicine. Okay. And the other specialty, it depends on a point, how many years experience, how many papers you wrote, volunteers, like points, people will collect it like a paper. So you can get a direct training job. This is for young doctors, huh? You can get a service job if you want. But for those who are seeking for the passports, Western passport and these things, yes. MRCP can take you directly to UK, directly to Irish, if you got the membership and IELTS exam. That's it. طيب. Until this point, any question? I'm not reading يا جماعة طيب, for the home care doctors, Dubai exam, no. I don't think so. Okay, they need it family medicine practice or primary care clinic. South Asia, they will accept everything, unless they will change their minds. But they are accepting any experience as a general practitioner. Whatever general practitioner, they are accepting. As I told you, to upgrade to a specialist, there is no fixed rule. But with people, experience of people, even recently, a few months ago or 1 month ago, 3 years experience, they will evaluate your file and your papers and your work and experience, and then they will no one rejected. I don't know anyone who had been rejected to upgrade himself after the membership. And even it is there in the policy and the guidelines in the DOH, DHA, MOH, you can go. The MRCP is a tier 3. Tier 3, that means we'll give you a specialist after 3 years. It will give you consultant after 8 years, but with some publishment and some papers or some activities and academic activities. As I told you, for الاعتراف معترف به في الخليج MRCP دبي معترف به في الخليج، معترف به في الإمارات مغيم أعلى من MRCGP ساوث إيشيا. أوكي. MRCP مغيم جدا. الاثنين بيدوا نفس الشيء، في 3 سنة بيدوا أخصائي. They will upgrade for a specialist after 3 years. Both MRCP دبي MRCGP دبي and MRCP UK or Ireland. طيب everybody knows يا جماعة ال MRCP in medicine there is 3 parts. Paper 1 same like AKT. Paper 2 same like AKT. AKT there is ops and gynae, there is a lot of ophthalmology, there is ENT, orthopedic, general surgeries. In the medicine version, the MRCP, these are not very much. Pediatric are not there. Very few questions in pediatric. There is some basic question, but not much. طيب فيبقى the AKT same the MRCP 1 and 2. We have many doctors يا جماعة, they are preparing with us and they sit for the MRCP. كانوا بيقروا معانا family medicine ال MRCGP ده ومشوا امتحنوا به MRCP من غير أي تعديل. If you want just to pass. If you want a high mark, there is a little questions which is very deep. يعني it can come. There is some question. It usually appear in the MRCGP. It will appear differently or not appear. خاصة the guidelines for the clinic. For example, a patient who came with a chest pain. In the clinic, we will give only, you know, what medicine we will give in the clinic and send. Give what and send?
Aspirin.
Aspirin. But in the MRCP medicine, you will give aspirin loading dose and
Clopidogrel.
ticagrelor. Clopidogrel is now outdated. Since last year, it is ticagrelor, Brilinta. So aspirin 300 and Brilinta 180. That is a difference. For example, there is many cases you will send by ambulance to the hospital. In the medical version, you are in the hospital. So what you will do, for example, a patient came to you with a weakness on one side of the face and dysarthria and kalas, there is a very high score of stroke. Then what you will do, we'll announce the stroke code and then we should do the CT brain and CT angio. And then I will decide as per the neurologist. There in the clinic, they will send by ambulance from the clinic. For example, epilepsy or seizures. In the clinic, yes. What we will do in the clinic for seizure? Yes. What we will do for seizure? If a patient is What is that?
Lorazepam.
Lorazepam is only a second option.
Diazepam.
If I told you will give
Midazolam.
buccal
Diazepam.
or rectal diazepam, which one you will?
rectal diazepam.
بكل
Buccal.
Midazolam.
You agree?
Buccal.
أشيل بكر ميدازولام.
Buccal
Yes.
midazolam first, and then rectal diazepam.
Yes. If you have a buccal midazolam in your options, you will never get the diazepam. Why يا جماعة؟ ناس معنا في الفرق.
Respiratory depression. Long duration of action.
The longer duration of action.
Absorption.
Fast. الاثنين will act fast in 1 to 3 minutes.
Absorption.
But the buccal midazolam is a little bit longer action. بعدين غير كده. It is easy to apply.
Easy.
Fast absorption, faster absorption than the rectum. Rectum مليان حاجات تانية. This is there's nothing. بعدين غير كده يعني بعد تقدر تفتش في الريكتم وتغطي بالملاية وكفر dignities وبتاع. Okay, instead of searching for the rectum, it is okay. You have the mouse here in front of you. So clinical judgment answer is should be buccal midazolam. طيب in the hospital, because there will be an IV axis and so there will be if there is IV axis, then the lorazepam. Okay, that is the difference, but it's not very even for the deep medical question nowadays, the MRCGB International, they have start to ask us deep medical questions, specialty level questions, hospital question. Why they said GB should know what this patient will be given in the hospital, although he is not allowed to give it in the hospital, but he should know. Like if he know, he will dispatch the patient to the area, to the hospital or the facility which have the ability to do that. يعني انت تكون عارف انه بيتعمل ليش نوع، عشان كده بتوجهه المحل الصحيح. مش انت عارف انه البيشنت ده في الويندو بيريود in the first 4.5 hours and he is for thrombolysis, so you should send him to an area where there is thrombolysis. Or if the patient asks you, doctor, no, I'm not going, why you will send me to the hospital? It is TIA and not gone. Alas, I don't have any issue. I don't have any weakness. So you should know the guidelines that this patient should be seen by neurologist within 24 hours, and MRI should be done. And then what next to the MRI, carotid Dopplers and dactectomy, if it is there. So you should know the steps of management when the patient reaches the hospital. So if the patient asks you why you are sending me to the hospital, you will know the answer. That's why they are testing us even in the medical, in hospital practice guidelines and hospital practice approach. طيب AMC standard pathway. The standard pathway, there is part 1, paper 1 and paper 2, and the same like an OSCE exam, it is practical exam. طيب. This is our advice يا جماعة. Choose the exam according to the career destinations, not the difficulty. Don't say, no, medicine is difficult, I will not go that one. If your career destination is medicine, why not? Many doctors, even in our hospital, so many doctors, they have the MRCP and MRCGB at the same time. So you can open the choices for yourself. طيب. Now, the preparation, especially those who did very genuine preparations, even before they got a seat, they can sit for MRCP. They can sit for the waiver. Okay, any question?
Yes, Doctor, thank you so much for this so much elaborative session. Doctor, I wanted to ask you, I have Ireland registration. So could you please tell me,
Sorry,
like,
come again, doctor.
I'm trying to ask you, Doctor, can you please tell me that what is the pathway for the as a GP specialist in Ireland?
GB, MRC GB in UK or Ireland is not overseas. You should be there. Because it is CCT.
Okay,
What is that?
Doctor, if I have Ireland registration, I do have Ireland registration.
Yeah.
So what is the pathway? What is the pathway for me to go there? What should I do? Like being in a Pakistan. So I am Pakistani basically. So being in Pakistan, how can I apply for the MRC GP specialist? I have come across this information that they do take some tests. So could you please tell me if you know something about it?
Yes, doctor, for MRCP in UK or in Ireland. If you have a GMC registration or Irish registration, you can apply for the queue for a training post. So it is same like a fellowship, not membership. You have the membership. You have the registration. You have registration. That means you have membership, right? You have MRCP, or how you register in Ireland?
So basically, I have registered in Ireland and in UK both, and through Play, but there is no jobs right now there. And regarding the the GP, there is a test which is called as MSRA, you know. And right now they have
Yes.
changed their policy. They are now prioritizing the UK graduates and not
That is
immigrants.
since GB, general practitioner, family medicine specialist, and cardiologist and rheumatologist. They are not giving it to non-UK people. There is no rule, but they are not intended to give it to foreigners, to immigrants. Even in US, even in the United States, it's very difficult to get a training job as a family physician. They reserve it for their locals. Okay, so it is not easy. It is not easy at all to get a training because it is CCT. So it's a fellowship, and if you got that fellowship, that is the best you can get. Even from the other specialties, even neurology, rheumatology, cardiology, gastroenterology, it's very. But if you want internal, acute medicine, tomorrow you can get a job. If you want ICU or emergency, it's very easy to get a job. Local people, they don't like these kinds of jobs, these kinds of careers. Family medicine is a very, it's a social compatible job. It's a social compatible line, especially for females and for men who want the peace of mind.
Okay, thank you, doctor.
Okay, all right. So now I will.
Doctor,
Yes.
RCBI, there is a long waiting list
No.
if I complete the second part.
No. There is a lot of centers and many diets. If you now open the MRCPI exam schedules, there is a very long list. Part 1, there is 4 or 5 dates. And part 2 like that. I didn't come across anybody have been put it in the waiting or rejected. There is a lot of seats because the very good question, yeah. A very important point I forget to tell you. MRCP, Ireland, you can sit from home for part 1 and part 2 written from home. Okay.
Excuse me, doctor. I have a question about the MRCGP for Ireland. Is it the same MICGP?
It is the same MICGP pathway. Yes, this is Ireland, but it is very difficult to get.
And I heard that I need to be in Ireland into the scheme, doing a service job so that I can get enrolled in there.
Yes,
correct?
And you will be waiting list, and they need points and points and points. There is very tough competition.
Doctor, I just would like to clarify one point, because I've been searching into that part. It's not the same as in the pathway where I can do the private practice here in the Gulf area and then sit for the exam, just like the MRCGP International, whether it is South Asia or Dubai. So I cannot go the same way. I need to be there in the scheme, doing the job, and then sit for the exams as per their eligibility. Am I right?
Yes, because there is difference between membership and fellowship.
Okay, I see.
MRCGP in Ireland, in UK is a fellowship, Zamala. Same like MD Sudan, rotation 5 years. Okay, this is a training. You will be as a trainer, the trainee. Here in the membership, you will just sit exam and you will get the membership, and the membership is the entrance to the fellowship. The membership is a step to get for those who want training job. The membership is your gate to the fellowship. Fellowship is equal PhD or equal doctorate of medicine. Membership is an entrance, but the membership here in the Gulf area will give you a specialist. And many doctors, they just want, especially the people who spend a lot of time in a service, they have experience, and they have no time to waste it in a fellowship. So they want 2 exams and get your specialty and class.
Doctor, I have a question since you mentioned this very important point about the fellowship. Now, if I did the MRCGP International, whether in South Asia or in Dubai, I heard somewhere that I can be a fellow after a number of years, fellow for the Royal College of General Practitioners. Is this right?
Like a fellow equivalent.
Fellow equivalent, okay.
8 years. But they need from you papers, publishment, some participation in studies, researches. It is like a committee evaluation. There is no fixed rule for it, but you will be eligible for applying to a consultant level equivalent. You will get specialist. For example, now in DOH or DHA in UAE. This is tier 3. Tier 3, as per the rules, after 3 years, you will be eligible to be a specialist, but after 1 exam. They will examine you. They will check that you are really practicing and you have experience and are not coming from home. So they will assess the papers. But that is like steps or paperwork. You will sit for the type. For consultant, that is after 8 years. And after the 8 years, again, same, they will evaluate. طيب, don't mix it with a local consultant in UK. Local consultant in UK, you can get it with the membership if you have a very long years of experience. For example, if you went with the MRCP or MRChem, emergency department, and you are very experienced, رانكرات الجماعة القدام ديل 20 و 30 سنة خبرة ديل, they will evaluate you for few months and they can give you consultant, local consultant. Local consultant is a hospital evaluation. Because there is shortage of consultants. Now, if you send one or you want to appointment, a routine appointment, I mean, they will give you a booking after 6 months or 7 months. Okay. I have my sister. She's a consultant in Guinea, and she have a cold operations. They gave her appointment after 6 months. She is in the hospital, and she's a consultant level. To do the operation, they delay her, I think, for 6 months, and then again they postpone her for another
العظم
months.
نفسه سليم. لكن إذا في مشكلة بالأربطة والأوتار، دائما إنك أنت قلتي زلقتي وطحتي فما حتظهر على الصورة، لازم سونار. فراح أحولك للملك خالد تروحي لهم بالطوارئ هناك تشوفي العظام حقهم ويسوي لك الصورة.
دور المايك.
مو موعد، لا تحويل للطوارئ حقتك.
Okay, I will.
السلام عليكم دكتور.
عليكم السلام. Yes.
يا دكتور بس ممكن تعيد لنا النقطة بتاعة ال RCGP Ireland اللي هو اللي بيكون انك انت remotely you can do the exam وكده، فبس الادفانتجز بتاعتها ممكن تقولوا لي في النقطتين او ثلاثة؟
MRCGP or MRCP؟
MRCGP بتاع ايرلند تقريبا.
GB
يعني.
No, GB you should be there. لازم you have a registration and you
ولا انت قلت تقريبا ال MRCP لكن ايرلند؟
لكن MRCP medicine.
اوكي هو ده معناته.
In medicine you can go. Medicine, if you have membership tomorrow, you can go to Irish and you will get the registration number and you will wait for the job. Or you can apply for a training job. There is service job and there is training job. Service job, you will go to just as a service, and you will do your shift duties and go back home. Training job, same rotation, same like the MD. Every 3 months or every 6 months in an area or in a specialty. For example, if you want to neurology. Neurology should be for 1 year in internal medicine, and then 6 months like in a cardio, and 6 months, 3 months in here, and then you will be for the neurology rotations with different consultants, and you will be under all this time, and you will get
the membership after that.
CCST, and then that is an consultant level.
دكتور سمعني ممكن سؤال لو سمحت؟
تفضل.
شكرا
دكتور بالنسبة للانترنال ميديسن، احنا عارفين انه في الممبرشيب اوف رويال كوليج اوف فيزيشنز اوف ذا يو كي، وفي تانية اللي هي الممبرشيب اوف ذا ايرلند الام ار سي بي اي.
يس.
طيب انا اللي عارفه، انا عندي زميلي امتحن اوريدي الام ار سي بي اي، وحتى امتحانه يعني ريموتلي يعني فروم هوم.
يس.
ايوه. طيب both of them are the same level, the same acceptance.
Yes, same everything. And you can work you can register in UK with the Irish. You can register in Irish with the UK, but should be full membership. For you cannot do MRCP Ireland 1 and 2 and you sit for the basis of UK. No. All the set in one country. If you got the membership, you can. I have many colleagues registered with the MRCP Irish in UK. They got the GMC registration. What is the difference, Jamaa, between Irish and UK? There is no difference. Irish is easy. There is a very wide centers. Part 1 and part 2, you can do it from home. Imagine there is no cost, only the cost of the fees of the exam. No travel, no headache. Everybody will get a seat. No one had been rejected at all. Easy. After 1 year after the internship, you can sit for the exam. So easy, very easy. And 2, also you can do it from home. The practical exam, the PACES exam, is not difficult and widely available. In the Gulf countries, there is maybe 15 centers. All the countries in Asia and the Gulf. And in any country, there is 2 diet. One in May, one in November, one in October, like that. And even in one country, there is 2 centers. Yani, for example, in UAE, there is Dubai, there is Abu Dhabi, and there is, I think, Dubai.
As doctor, we can do the exam from home, صح? But we have to
Yes.
be in the same city.
كيف؟
يعني مثلا إذا كان الإكزام في سنتر في أبو ظبي أو كان في سنتر في دبي, I have to be in that city in my residence to do the exam.
No, you can do it from anywhere.
Okay.
No, not in office. Yeah, the Irish one. That is the Irish one only. The UK, there is a hall. You will be in the
by the British Council. أيوة.
Okay. The UK in a center in a hall. The Irish from home. طيب, the basis exam available in many countries for the Irish, and easy, you can get a seat.
طيب ما كانوا بيقولوا شبه مستحيل يا بوس يعني زمان كانوا بيقولوا انه ما في chances للبيسز وانك انت ممكن تمتحن A و B
ده UK. That is the UK basis. There is waiting list.
Okay.
But the Irish, there is a lot of centers. There is a lot of centers, and in any center there is, for example, in UAE there is 2 centers 4 times per year. I mean, yani two centers. Every centers have 2 diets. In UAE, for example, even the PACES, there is no long waiting list because there is Abu Dhabi Center, Dubai Center, Sharjah Center, Ajman Center. Every
this
center.
is for the MRCP, okay, صح?
Basis exam, yes, UK.
Okay.
The practical one. Okay, the practical one. What is the difference from MRCP? MRCGB. MRCGB is a SP, is a simulated patient. Is not a real patient. There is no clinical findings. The basis exam of Ireland, the basis exam of UK, there is a real patient. There is patient in cardio with murmurs, with scars, cabbage, valve replacement, batteries. There is spleens, livers. There is neurology. There is paraplegias, hemiplegias, facial palsies, peripheral neuropathy, Charcot-Foods, Parkinson disease, multiple sclerosis, a lot of cases, Friedreich ataxia, anemias, a real case. Okay? The tough part is the clinical findings. There is a real clinical findings. If you miss it, that is a big problem. Not like the SB in MRCGB. You know, he is a malingering. He is not, not a malingering. He is an actor. You will just talk. I want to examine this. I want to examine this. The examiner will give you the findings. So that is very easy, the MRCGB. Basis exam is a little bit tough. Need special preparation. Need to do course, live course, hand on patient course. Okay. دكتور تسأل من أستراليا ساوث إيشيا بيدخل أستراليا بحاجة اسمها PEP باسوي. بيدخل المدن الصغيرة M3 M4 M5. هم مقسمينها هناك المدن للإمات. M1 this is the capitals and the big cities. Brisbane, Queensland, Sydney's like that. This is, you cannot go with the MRCGP International South Asian. That is only for the RCPs there. Small towns, also medium towns, no? But the MRCGB, you can go directly to Workplace Smith Assessment Pathway. It's called BAB. You can go to the website of the AMC or and a lot of doctors now. We have colleagues who did the exam. They finished the membership the last year, and May 1, April 1, and now they are preparing for the travels. We have many doctors who are there now and they are working, and we have message sent from one doctor who participated in one meeting before, but because of time difference, we are unable to connect him today. But his message is there. I share it in the Telegram group, his message about how you will go there in Australia and what is the benefit and what are they doing and how you can upgrade, how you can get the full RCGB Australia. Question? Yes.
أنا يا دوب جاي معلش سؤال يمكن يكون يتجاوب. ال MRCBI هو يعادل MRCGB؟
لا. ال MRCBI
أيوة.
MRCBI this is a medicine.
medicine.
Yes.
طيب في إيرلندا في GB؟
Yes, لكن only for those who are working there inside. الناس اللي شغالين في ايرلندا اصلا.
أيوة لأنه بحثت عنه كتير ما لقيت أي زول يجاوبني.
لا شايف في ناس كتار يا جماعه بيقدموا MRCGB sorry RCGB UK RCGB UK exam don't apply for it. That is only for those who are working there. And the data are different, timing is different. Okay.
طيب ليه ال MRCBI خيار لنا؟
كيف؟ come again.
إذا إحنا مثلا أنا ماشي في لاين الجنرال براكتيشنر as family medicine وهو ده medicine MRCBI هو medicine صح؟
Yes. يلا what is the benefit? The MRCB
أيوة أنا قصدي ليه بقى option for us؟
okay. It is not option for family medicines. It is option for if you want to be just a specialist in internal medicine. So you can upgrade. But if your line is family medicine, the only benefit you can get it from the MRCP, other than line in the CV, you can get entrance, you can work in Ireland. In Ireland, you can apply for MRCGB. fellowship يعني بيدخلك ايرلندا تلقي جوب تشتغلي وتنتظري ويتنج ليست انك تلقي فرصه تريننج فاميلي ميديسين، لانه لازم تكوني موجوده عندك ريجستريشن وشغاله سيرفيس، خدمت الدوله سنه سنتين شهر شهرين، بعد ذاك تقدمي تقفي في الطابور بتاع الفاميلي ميديسين ايرلندا وديك زماله.
مدخل ال MRCGP ايرلندا.
ايوه درب طويل طبعا. طيب البنفيت شنو بتاعت الام ار سي جي بي ساوث ايشيا ناو؟ اذا ما في حد ماشي استراليا، البنفيت 3 years تديك سبيشالست. اوكي طبعا اوف كورس يا جماعه there is big benefit والله. Now in our hospital for example, now we have job, there is maybe 20 or 30 files will be applied for that job. And our hospital is a very expensive hospital and a high payment hospital in UAE. Okay, they will not accept anyone who don't have membership. MRCP, MRCGB, MRChem. There is no fixed rule, but if there is 30 files came to us for a GB in primary care clinic or in emergency department or a junior GP in internal medicine or whatever, we look at the file, the CV. The first or the most important part of the CV is the qualifications. Then the experience, experience in Gulf, experience in Europe, experience in the same country. طيب, what are the qualifications we are looking for? No one will look at the MBBS from where. No one will look at any courses here and there. We'll look at where is the MMMM. Where is there is membership or no? Okay, it is a very important line. In Ireland, there is service job for some countries. Among them is Sudan. You can't go without membership, but only will be stick for service job only. يعني people that are not going for service. Service في بريطانيا, service في Ireland, very poor. يعني hardly you can just live and eat and يعني very poor life. Very expensive. The income is just to keep you alive. So no one will go for income for يعني financial issues or يعني it's not اغتراب يعني. People going there only for training or for passport. MRCP معترف به في الخليج. Yes, there is no fixed rule. معترف به في الخليج. Yes, after 3 years you can upgrade with it. It is same like MRCGB South Asia. It is same. يعني this is RCGB accredited in Pakistan. This is RCGB accredited from Dubai. Everything is same.
دكتور شو بتعني انه MRCGB from Pakistan؟
The South Asia.
ايوه
The South Asia ده هو اللي ما قادرين الناس تقدم له ده. بيكفل في 6 دقائق ده.
دكتور معلش بس لو مقارنة بين ال MRCP حق ايرلندا ويوكي من ناحية الامتحانات وسهولة النجاح، في فرق بيناتهم ولا نفس الحاجة؟
The Irish exam is easy. Is easier.
الماتيريال بتاعته
easier
متوفرة
in finding a seat يا جماعة. غير كده you can do it from home. Part 1, part 2 from home. From your computer, from your laptop. يعني you can sit at home. There is camera will be open. يعني they will ask you to sit in a quiet room, closed, nobody going in, nobody going out. يعني with a very few furnitures. And they will ask you to scroll the cameras around the room, and they have how they can see you in the camera with your laptop camera, for example, or PC camera. And you will have application to test your camera before the exam, to test your mic, and then in the day of exam, before 5 minutes, they will open the link for the exam. You will open it, it will close automatically after 3 hours. And that's it. So you can have your breakfast at home, and then you can have your coffee after the exam at home.
يا بص الو
Yes, doctor.
بالنسبه لامتحان دبي الMRCGP دبي
Yes.
يعني التوتال كوست بتاعت الثري بارت كم ولا
about 15,000. three
الدكتور
الثلاثه
يس الثلاثة.
الثلاثه كوست 15.
الجزء الاول والثاني
الثلاثة ممكن الثلاثة زي ما قلت لك الثلاثة ممكن تمتحنهم في أسبوع واحد.
يعني الدكتور شو تقصد بالثلاثة؟
درهم ولا؟
بالدرهم.
ايوه
دكتور شو تقصد بالثلاثة؟ يعني ستيب 1 وستيب 2 وستيب 3 بالMRCOGP، يعني بيبر 1 وبيبر 2 وكلينيكال.
Yes, there is paper 1 MCQs. There is paper 2 MEQ, small notes, focus point note written.
Okay, yes.
Now I am going to show you examples, يا جماعة. If there is no, I will.
And when they have started this criteria, when they have started that there is EMQ.
MEQ, since long time.
And about 2 years before, 3 years before, because a long time ago there was no EMQ.
No. You are talking about Abu Dhabi, South Asia, Abu Dhabi. The same Pakistan exam. This MRCGP South Asia, they was centered in Abu Dhabi.
Yes.
That one is closed now.
Now it's only in Pakistan.
الامتحان يا بص الباص بتاعه يعني هل فيه كيرف مثلا زي الساوث ايشيا كل مره بيطلعوا الباص ليه؟
same everything.
يعني كل مره بتكون عنده نسبه نجاح.
يس سيم يا جماعه. الكيرف ده بيبقى ثابت هو.
وعاده الناس اللي بتمتحنوا يعني اللي بيباصوا بيكون نسبه كبيره منهم ولا؟
طيب انا داير I will share with you if you can see MRCGP International exam.
Doctor, still there are a center in Dubai.
This is the one, Doctor. Yes, you can see the screen. This is the one. Okay, I will show you the result of the last exam. Where is the exam? This is the program. This is the admission criteria. Timeline. This is for the last. See, this is for the last 2025. The opening of the registration was on 3rd of March. The closure date on September. It is open for a long time, even until 1 month before the exam it is open. See how many months is? From March to September the application is open. This is the last one.
About 7 months.
October. Okay, the application is open. They will collect the application, collect, and then the exam will be on October. This diet, because of the current situation يا جماعة الحرب الإيرانية والحاجات دي لأنه بيجوا دكاترة من UK وكلام زي كده فشنو ترافلز فيه مشكلة security wise they delay until now they are assessing they will open for October or no. I contact them personally. Okay, they are assessing the situation. احتمال يفتحوا October exam application.
فيها عايز بيض مسلوق او بيض مقلي.
اوكي.
موسى بيض ولا مقلي؟
الريتن
مقلي
في 22 اكتوبر، الاي كي تي 23 اكتوبر، الكلينيكال اوسكي اكزام في 25 اكتوبر.
دكتور الابلايد نوليدج تيست الاي كي تي هو عباره عن الام سي كيوز؟
يس،
هو عباره عن الام سي كيوز. الاول الام اي كيو عباره عن شورت نوت.
This is a short note. Yes, scenario.
Yes, so-
There is multiple question on that scenario. The answer will be written text.
short note.
It is
Yes.
computer based, by the way. Okay, I will show you the result. There is not much people that are applying.
And دكتور الإجابة بتكون على الكمبيوتر، يعني ما في written
Yes,
paper.
yes, on the computer. Now I will show you the difference. I will show just example يا جماعة عشان نستفيد من اللكشر برضو academically. نحن أصلا مستلفيننا من هذا الكورس. Okay. Let me show share. طيب, this is a example. If you want the application, you can just click this is the fees. This is the fees. Each model 5,000 يا جماعة. Each model 5,000 AD.
يعني رسوم كل امتحان 5000
Yes,
ريال.
the three exams are 15,750 بالضرائب. يعني حوالي 16,000.
نعم.
Okay. طيب, application. This is application. You can just click that on instead of exam date. Application form.
ودكتور الامتحان بكون يعني الامتحان الأول شورت نوت الاي ام كيو، الامتحان الثاني اي كي تي.
I will show you examples of from our topic today. This is the application form. You will fill it. You will upload your documents.
دكتور معلش، بس قبل ما نمشي على الابلكيشن لازم اعمل اكونت واعمل لوج ان، ولا بس ممكن ارفع الابلكيشن فورم دايركتلي؟
No, directly.
Directly. I don't have to create an account.
No.
Okay, thank you.
Okay. Yes, very important. The style. I will show you the difference. عشان الناس those who are preparing how to use their preparation for the other exam. Well, this is the most important part of this lecture. How to use your current preparation. في ناس يعني شنو لها سنة وسنة ونص بيحضروا للإكزامز. They are not sitting. They didn't sit. Okay. So
دكتور هذا الماستر ميدكس it is for AMC Australian Medical Exam.
No. Is our platform. This is our platform where يعني we are there is MCQs, there is question bank, there is note bank, there is video bank. Same like Bas Medicine on exam like that. But it is very specialized for the MRC GB and MRCP.
أيوة ميدكس.
Okay, this is our own platform. Okay. Why it's not there? Just 1 minute. Membership comparison.
يعني دكتور الميدكس هو مش انه انت هذا الموقع تبعك يعني موقع من للام ار سي بي وللام ار سي جي بي.
Yes.
ايوه زي موقع الاي ام سي ام سي كيوز،
زي موقع الباس ميديسين.
باس ميديسن.
اوكي سيم لايك باس ميديسين.
فيه محاضرات وفيه فيديوهات لكل سؤال يا دكتور، يعني لكل سؤال بيشرحوه فيه فيديوهات.
I will show you sample now. Just give me just one minute.
Yes.
معلش يا دكتور سمان، عن إذنك بجاوب للدكتور ممكن؟
يس تفضلي.
يا دكتور اللي بتسأل موقع ماستر ميديكس، موقع مخصص بيشتغل فيه دكتور السماني نفسه، عنده فيه محاضرات لايف، وفي كثير من الناس الآن معاك مشتركين معه. زي ما
نعم.
قال لك فعلا، هاي فعلا بيستفيد منه أكتر شيء الناس والمعلومات طبعا كلها عامة، لكن مفيد جدا والله. شغالين معاه وإحنا معاه مشتركين معاه فيه. البوس نفسه موقع تقريبا زي ما تقول مخصص حقه هو، إذا سمح لي يعني جاز التعبير.
Yes, welcome.
عشان نفهمك. أيوة.
Thank you. I will give
حلو.
you from the Master Medics Question Bank. Yes, the topic of today is multiple sclerosis. يعني a little tough part of the medicine, but
يعني دكتور أنت بتنصحنا إنه نشترك في هذا الموقع؟
yes, inshallah, it's يعني we'll get benefit from. You can log in, and then there is infectious system is open, it's free. You can check the system if it is matching your requirements.
Infection disease. نعم.
Yeah, infectious disease. I will show you how to log in. Now, this question, for example, is this question is AKT question. Okay. طيب نشوفه. No.
برضه يا دكتور لو في نماذج او نموذج لامتحان دبي ده للشورت نوت كيف للاوسكي كيف لامتحانات قديمه ولا حاجه زي دي طريقه الاسئله كيف؟
Yes, I'm sharing with you now. شايفين السكرين؟ كده أوضح شيء؟ الشاشة واضحة كده يا جماعة؟ السؤال واضح؟
لا لسه ما اجت يا دكتور، ما وصلت. دكتور الماستر ميديكس قد ايه اشتراكه حركة بالسنة، يعني إذا بدنا ناخذ سنة؟
There is I will show you. There is two package. There is a package with the course. There is package with the course, live lectures twice per week until the exam date, and there is crash course, comprehensive revision in the last 2 weeks, and recording of the previous course, the full recordings. And there is only the question bank, which is like more than 4,000 questions, and the videos. The full course is 1,500 dirham, and the other one, the basic, the essential one, is the 750. Now this questions is from the question bank of the multiple sclerosis. Can someone answer يا جماعة؟ عشان ناخذ لنا شوية academic benefit للناس.
What?
I will show you the AKT. This is AKT style question. This is 31 women presented to GB presented to the GB. That means this is a style of AKT. Right? Those who are preparing for the exam, they are reading this one. I will show you the same question in a medical style, MRCP style. The same question in MEQ style. Okay? Now let's answer. 31 women presented to the GP with intermittent neurological symptoms over the past 18 months. A report episode of painful loss of vision in the right eye, resolved 4 weeks. 8 months later, she developed numbness over the right side of the trunk, which improved spontaneously. She now complained of increasing unsteadiness and urgency of micturition. Type. Examination, visual acuity 6. There is a relative afferent pupillary defect, horizontal nystagmus of the left eye, spastic weakness, brisk reflex. So, all the housing of symptoms and signs of upper motor neuron type lesions with the relapse and remitting. MRI show multiple periventricular and juxtacotta T2 hypersensitivity lesions. Spinal cord show same enhancement at C4. These are the blood tests. Which finding best demonstrate dissemination in time according to the McDonald's criteria?
Simultaneous enhancing and non-enhancing MRI lesion.
Yes, simultaneous enhancing and non-enhancing lesions. طيب. What is the relation between simultaneous enhancing?
It basically means dissemination in space and time.
Yes, very good. Actually, don't say this question is a high-level question. This question came in the exam of year 6 in our medical college. And it is the same time similar questions came on. So different, same like chicken box. Chicken box, there is multiple lesions, different ages, right? There is the small papules, the macules, then babules, then vesicles, then crust. So it is different ages. Here there is simultaneous enhancing and non-enhancing. That means there is old lesion and there is new lesions. This matching, these findings in the MRI telling us there is dissemination in time. You get the dissemination in time by the MRI findings. This is very in keeping with the multiple sclerosis, because we cannot diagnose multiple sclerosis with one lesion with one time. We need an evidence that there is a previous lesions which is healed and now it is come again and disseminated inside also. Today is eye, next after 3 months is a leg. So it is coming from here and then spares in time and place. This is the akhlaq of this is attitude of multiple sclerosis. The diagnosis of multiple sclerosis require dissemination in space, dissemination in time. MRI of enhancing and non-enhancing indicate there is an old lesion and a new lesion. There is a dissemination in time. Type. This is a description of the multiple sclerosis. All right. So this patient is having multiple sclerosis, relapsing, remitting, and 3 days have dysuria and urgency. Oh, sorry, urine frequency, febrile, nitrate positive. That means this is MS patient with a UTI. An MS patient came to you with a UTI and no new cranial nerve sign compared to the previous clinic documentation. What is the most appropriate next step? A patient with MS came with UTI, what you will do for her? Start misal prednisone immediately, arrange urgent plasma exchange, treat urinary. Someone said C, treat urinary tract infection first, and start dose modifying therapy or repeat MRI. So treat the urine infection. Why?
Because this multiple sclerosis exacerbates with infection. Because it is triggering, and it seems like he is having a recurrent episode of multiple sclerosis, but is it actually the UTI which is triggering?
Yes. So if in the clinical patients with multiple sclerosis came to us with a urinary tract infection, we need to treat urinary tract infection first because it worsens the existing neurological deficit due to increased body temperature. And we know that multiple sclerosis is a demyelination disorders. The immunity attack the myelin sheath. The level of the attack to the myelin sheath is expressed by the level of the clinical presentation. The myelin sheath destructions is enhanced by the temperature. Even if the patient took a hot shower, he will feel more weakness. Exposed to sun area, it will have. Okay. Right. These are the AKT style question. Now I want to take you to the MRCP style question. Sorry, MEQ style. This is the MEQ style. A long scenario, 29 years old teachers attend the family medicine clinic, complaining of intermittent neurological symptoms over the last 18 months. He have lesions and then spontaneously heal, same like the first one. Relapsing, remitting, disseminated in time, temperature 36, blood pressure like that. There is clinical findings. There is blood test. Question 1. What is the most likely diagnosis? And list other 4 clinical features in this case support your diagnosis. Gibel in the MCQ.
Multiple sclerosis. Diagnosis.
Yes. So the diagnosis is multiple sclerosis, other clinical features supporting this. Why you choose this? Can you give us 4 points supporting your...
Doctor, that is related to this question, or we can say anything that we know about multiple sclerosis?
You in this case.
In this case, yes.
So you need to answer according to the scenario.
So again, dissemination in time, because there were 3 separate episodes and the age was less, so young patient, and she's female. And she had optic neuritis, and there was urinary urgency, right? And there was gait problem. So these all shows demyelination.
Yes. So now you got the point, and how are the MEQ came? That is a long scenario, and this is one question with a 4 mark. Actually, it's same like practical exam. Now we can say, my diagnosis is relapsing remitting MS. What is your most likely diagnosis? My diagnosis is relapsing remitting MS. Give me,
Doctor, if we say only just multiple sclerosis.
They can like take 0.5 or 0.25 from your answer. So if you said relapsing remitting, that is what they want. What? Okay. Give me 4 features supporting this diagnosis: previous optic neuritis, sensory deficit.
طيب يا بص التايم بتاع الامتحان ده بيكون نفس الام سي كيوز.
The time is 3 hours, yes, for the 15 questions.
For that?
The time is enough. The time is enough. Okay. And now I want you to know the style. Okay. يعني how you can get benefit. Are you ready? From ما في ناس كتار زعلانين قالوا ما لقوا seat. I am asking them, are you ready? يعني if you got the seat, are you ready? For many doctors, they are getting the seat and then they start to cry.
الشورت نوت ده 15 15.
Okay. I will give you the whole details. You will find it here. Now let's the question 2. List 5 important differential diagnoses.
Okay, so neuromyelitis optica and subacute combined degeneration.
Normal pressure
And
hydrocephalus.
Unlikely in this age. So neuromyelitis optica,
sarcoidosis,
neurosarcoidosis,
neurosarcoidosis.
very good. So I would like you to answer neuropsychosis rather than just say sarcoidosis.
Yes.
Doctor, if we say sarcoidosis, we will not get the mark.
They might deduct some mark.
Yes.
So you say neuropsychosis. To be very specific, this is same like in the OSCE exam. If you want to tell the patients, I will give you, for example, ibuprofen. You cannot say I will give you ibuprofen. I will give you ibuprofen 400 milligram twice daily. Take it after food. Full answer. Okay. Subacute combined degeneration of spinal cord, cervical spondylitic myelopathy, sarcoidosis,
HIV or maybe
NCNS vasculitis, Lyme disease, for example.
Neurosyphilis.
Okay. Then, what further investigation would you arrange to confirm the diagnosis and exclude important alternative? Give the reason for each investigation.
نام يا حبيبي نام. أنا مش هتنام مكاني، نام عندك.
Of course,
first,
doctor, we will try to do the multiple sclerosis investigation, which is the MRI and lumbar puncture, and we will check for oligoclonal bands for CSF.
Brain and spine.
Yeah, MRI brain spine.
With gadolinium.
Yes.
Okay. طيب تاني. What else?
CSF oligoclonal bands we will check.
Looking for what is the justification?
Oligoclonal bands. Huh?
Yes.
For multiple
I would like you to say CSF looking for oligoclonal band not found in the blood.
True.
Again, doctor, oligoclonal band that it is not shown in the blood?
Yes. Okay. Because this is the typical findings. This is a significant oligoclonal. If oligoclonal band is found in the serum, there is a lot of causes other than MS that can lead to raise the oligoclonal band. So the oligoclonal band in the CSF, negative in the serum, this is typical for MS. And very impressive if you said it like that. If you say CSF oligoclonal band, yes, you know. But if you said not in the serum, the examiners will be very happy. And even if you didn't mention, you mentioned 4, they can give you the 4 mark. Okay. So the other one is
aquaporin 4 antibodies.
So vitamin B12 level. We said SLE, then autoimmune screen. We said neuromyelitis optica, then AQB4, immunoglobulin, like that.
Yes.
Okay, doctor, this means that we will say neuromyelitis optica dash immunoglobulin.
Yes.
Okay.
Yes. So that is a style of the MEQ. For example, for this question, there is like an 8 questions from one scenario. Okay. Doctor who asked me how many scenarios, how many questions, how many questions in the MEQ? Every question.
Yes, doctor.
Yes. There is 12 MEQ, 12 questions. There is 12 questions in 3.5 hours. Okay. Same like this one, there is 12. Every questions, it have multiple questions. All this is one question. السيناريو واحد, this scenario, 29 years old, blah, blah, blah. And this 8 questions, this is one scenario. There is 12 scenario. I told you, Ijma, same like OSCE exam. Which in the OSCE exam, there is 15 questions, 15 cases. And in this 15 case, they will be asked about the investigation, management, non-pharmacological, pharmacological, referral, follow-up, safety ratings, vaccinations, communications, like that. Same 3.5 hours. The AKT is 180 question. It is also 3.5 hours. Okay. Okay, I will show you now the MRCP1. This is a style of MRCP. طبعا يا جماعه multiple sclerosis والنيورو الطبق دي بالذات صعبه. يعني الامتحانات الحاجات الثانيه في الهايبرتنشن والدايابيتس دائما very very benign questions. Okay. مثلا this is 27 patient with a history of painful visual loss affecting the right eye. Previously have numbness. So feature of my MS, especially if you said painful vision loss, and there is previous neuro, there is a defect in the vision, MRI brain, there is Dawson fingers, multiple periventricular juxta hyperintensities. يعني there is sclerotic lesions, or there is Dawson fingers, or sclerotic lesions of different shape and age, different enhancement. Okay, which of the following MRI finding demonstrate same. في فرق يا جماعه ما بين السؤال ده والسؤال اللي قبله في نكتي same. Okay. There is some questions there will be difference, and there is question in MRC GB not coming in the MRCP. For example, opsan gynae, pediatric, مش عارف شنو هذه. Okay, this is the question of the infection in MRCP. 34 woman present with relapsing remitting. She have burning urine, temperature, urine nitrate positive, leukocyte 3 cross. Neurological examination was okay. What to do next? Same answer. For example, here, what is the explanation? Lando part 1, there is a little basic. They will ask you what is the explanation instead of what will be your decision. Instead of checking your clinical judgment, it will check your understanding of the basic. But not very basic, yani. Okay. So what is the infection will do? The infection will do pseudo relapse secondary to infection. Okay. Still, it can test some treatment. Okay. For the MRC, some doctors ask about the emergency MRChem. No, MRChem very tough. Not tough because of difficult. No, the paper 1 in MRChem is the basic of the basic. they will ask you in this tissue there is Golgi apparatus in the cells or not. The femoral nerve, when it came outside the pelvis, it came medial or lateral to the medial rectus. Very basic of the basic, especially anatomy, physiology, and pathology. They will ask you of the receptors, the molecules. They will ask you where is the platelet will work, in which receptors. It is in aggregation, the aspirin aggregation or activation of the platelet. What is the receptor of the clopidogrel, like that.
Doctor, this exam, MR
MR is emergency medicine.
MR come emergency. This is emergency medicine.
Yes, emergency UK.
MR Chem.
Yes.
And again, the same thing, AKT plus EMQ, same like this?
There is paper 1 basic, paper 2 MCQs, clinical, and third exam is the practical exam. Practical exam is a station. Some station with mannequins or some station with real patient.
Simulated and real patients.
Yes.
In basic, again, the basic is MCQs again?
Yes, it is MCQs.
Yani paper 1 MCQs. Paper 2 again MCQs.
Paper 2 MCQs. Yes. And
paper 1.
Yes. Same
Doctor,
like
how many questions,
MRC
doctor?
London.
How many questions
ما في-
paper 1 and paper 2?
In which one?
In emergency, for emergency. MR Chem. Paper 1, how many questions? 100?
In MR Chem, the part 1, 1 minute. The part 1, 180 question.
يعني paper 1, paper 2, both 180.
180 paper 1.
180 paper 1.
Yes, it is same. It is same, but 3 hours, not 3.4. Paper 2 also, paper 2 180 question, لكن 2 papers. Yani paper 2 you will sit in the morning and again after 1 hour break you will come again another paper.
This means that 90 question each paper.
90 question each paper, yes.
90.
And each paper is 2 hours. There is 1 hour break.
Yes.
In the OSCE exam, there is 16 station. Okay,
16.
But distribution. Yani in the basic, in the paper 1, there is 60 question anatomy, 60 question physiology, 60 question multiples. Pharmacology, microbiology, and they will bring more than 10 questions in the researches. Odd ratio, ما بعرف predictive value, positive predictive, negative
يعني
predictive.
doctor 60 questions anatomy, pure anatomy.
Pure
Again, 60 question again pure physiology.
Pure physiology.
And again the other subject is 60 questions.
Yes,
subject.
pharmacology, pathology, microbiology, and
maybe put the statistics.
Yes, statistics. Last exam, 1 month ago or 2 months ago, there was pharmacology more than 60 questions. Pharmacology and basic science are very much, most of the exam was pharmacology and basic science. They brought more than 10 questions basic science, like an odd ratio, positive predictive value, number need to
statistics, 10 questions.
Pairs, studies, studies of pharmacologies.
There will be vaccination questions.
No.
No vaccination.
No vaccination question. This is a vaccination usually is a preventative medicine. This is for MRCGP.
MRCGP. And how many questions in MRCGP in vaccination, doctor?
Not
how many?
Maybe one or two.
One or two.
That is an ocean. Yani, for example, in our courses, we have 90 lectures per course.
Yes, yes.
The 90 lectures, every lecture there is, yani, we are targeting 2 questions. Yani, now we are studying, today we are supposed to do in our course group MS and Guillain-Barré, CIDP, and neuromyelitis opticus, and others. These 4 topics,
yes,
we are expecting 2 questions. So if we are if we did a 90 session, 90 lecture, and from every lectures we got 2 questions, we already got the whole exam. And
yes,
the last exam, more than 85 to 90% of the exam came from our revision, directly or somewhat indirectly. And alhamdulillah, there is the hard work had been done by the candidates. It doesn't went, it doesn't lost. Only 2 or 3 they came, they are waiting for another chance. All they pass, alhamdulillah.
Good, very good, doctor. Yes.
Now I will show you in the remaining minutes, those who are asking about how they can use can apply or can log in. So they
عشان هو فادي يقرب. لا انا ما تطلع بفتح العربية، خلي قلب كبيري، خلي جهاتهم في جيبهم، جهات نايمة، العالم كله بيطلع معي. لا هون دايما متابعيني، ما بيطلع شو.
my categories.
انا ما تجي معي.
I'm sharing هنا ولا
دكتور MRCP حق إيرلندا ما فيه بيزك ساينس في البارت 1؟
not much. معظمه كلينيكال، حتى البيزك look like clinical.
اوكي شكرا.
Okay, this is our platform يا جماعة, in which you can log in. If for those who want to apply, you can go to pricing. Here it will show the package. Even if you can click the question bank, but because I have here, so just go to the price. That's if you want another other than the AKT, for example, MRC OSCE exam, and now we are filling a question bank for MEQ for those who want to sit for the Dubai exam. Those who are they can we will set the package. It will be very affordable for MEQ, the whole syllabus, the whole curriculum. We will make an MEQ questions, same like the question bank of the MRCGP AKT.
Doctor, excuse me, in MRCGP UK, it is only MCQs set up paper, only MCQs, no EMQ in MRCGP UK.
MRCGP?
MRCGP UK. It is.
There's no exam like this. That's a selection. That is a rotation. That is a training.
No, MRCGP UK.
ما في امتحانات membership. The membership only for those who are sitting inside. Yes, there is same like AKT, and there is
EMT.
same لكن not for us. This is only for UK residents.
MRCGP UK is only for UK residents.
Yes.
Okay, yes. For us, it is known as international.
Only international.
Yes.
Only international. Dubai or South Asia, Pakistan. This is how we are arranging this website. For example, if you want to study headache, طبعا we are arranging it differently. Why? Because patient will come to you with headache. He will never tell you this headache is a headache of infectious disease, or this headache is a headache of hypertension, or this headache of ophthalmology. So there is headache. So we create a headache note. Every presentation with headache, you will find it here. So
Again, Doctor, what you said, every headache, what you said about every headache,
so you will find the headache that can come in the exam. Of course, no.
differential diagnosis, all types of headache.
How the headache can be, whatever how the headache will present in the exam, you will find it in one topic. You can attend the video. You can go to the note, open the note for headache. Okay, this is a headache, migraine, tension headache, cluster headache, subarachnoid hemorrhage, like intracranial hypertension, medication overdose. All the headaches notes is here. Okay, so every types of headache, and there is comparisons between the two twins. For example, how to differentiate between intracranial hypertension, idiopathic hypertension, and brain tumor, for example. How to compare between the two. What are the key points to differentiate between every two squeezing points? For example, how to differentiate between the sharp headache, SUNKET, trigeminal neuralgia, paroxysmal hemicrania, cluster headache. How to differentiate? What are the key features? So we make it very easy and concise. And from here, you can differentiate. You can get also what is the criteria for diagnosis, what we're finding in the examination. So in the scenario, you'll say patient come to you, complain of on examination. There is, if they ask you what is the next step, what is the gold standard test. So I don't say this website is the best for knowledge, but I can say it is the best for exam. Okay, it is exam oriented, and at the same time, the exam oriented means practical oriented. Okay, now if I finish the note, I want to test myself. You will go to the question bank. You will find here a squeezing question, and every question there is a thorough explanation. And again, there is comparison tables between the two squeezing points. For example, this is squeezing you between medication overuse headache and headache. How to differentiate between the two, or migraine with aura or migraine without aura. What are the difference between the two? Okay, and what is the key points? What is the key points that will help you to read, to answer the question quickly while you are reading the scenario? and that is applied for the whole curriculum, for the whole لكامل المقرر بتاع شنو MRCGP. Infectious, contraception, hematology, all the topics, all the system are same like this. Even now, for the ethicals and legal issues is there, smoking and alcohols. For example, hematology, hemolytic anemia, coagulation disorders, hematological malignancies, all together. Okay. Any question, you want?
Doctor, excuse me, if you please, doctor, to send this website in the group that we will save it and we enter through this. Send with this website to the group.
I will send you the link for the website here.
Yes.
Okay. You can just write mastermedics.com. That's it. But I will send you the link in the groups so you can join. You can log in, make your accounts, and then you can go for there is as I told you, infectious disease is open, and also I will open the ECG. I want to show you the ECG. Actually, this is it is uploaded. Those who are in the course, please go to the ECG. I spent like 1 week in this questions of the ECG to calibrate it with the this. Where is the ECG? Where is the cardio? Yes. So you will find all the ECGs in Erisbius, like an 88 questions with 88 ECG.
How many ECG, doctor? 88. 88.
All are scenarios. For example, okay. Now
كافي يا بص، كافي جدا. خلاص نكتفي به وكده. زي ما بقولوا يعني يعتمدوا تماما خلاص كده.
إن شاء الله more than enough.
إن شاء الله.
وطيب يا بوس بس يعني التايم for preparation MRCGP عموما بيكون كم؟
This depends whether you are in the practice or starting from zero, and whether you have time to do practice daily or not. I highly recommend, for example, today, say we discuss multiple sclerosis and the Guillain-Barré. Okay, say you need to go to the question bank and answer it by yourself and try to squeeze yourself to answer it in 1 minute. Every question in 1 minute. There is mock exam. There is mock exams. One of these exams is a recall. One is a tough mock exam. There is a lot of recalls. All the recalls of the last 4 or 6 exams, all are calibrated. The 200 questions are answered correctly and reset it and rewrite it. طيب, how to prepare?
Doctor, what you say about the Oxford Handbook of General Practitioner book?
It is not for exam. Exam there is tricks and different. يعني it needs special preparations to be familiar with the exam.
With the examination, yes.
Because if you want the knowledge will give you, for example, treatment for Guillain-Barré is either plasmapheresis or IVIG, right?
No, yes. Immunoglobulin or plasma.
The question will not be honest like that. The question will come to you, doctor. This patient came to you with the shortness of breath. He's having diarrhea for 2 weeks, and now he came to you ascending weakness, and he started to have shortness of breath now. They gave you to choose between IVIG or plasmapheresis. What will you choose? You need one.
IVIG.
Both are correct, but you need one answer.
Yes,
So,
of course, IVIG, because that is quick.
yeah,
Plasmapheresis
because
is expensive. It will take time.
yeah, and because the patient have shortness of breath. But if the patient have no shortness of breath, he's just having just starting weakness, and he is okay otherwise, and there is no. Class, remove the antibodies. That is the best treatment by the plasmapheresis. This is a clinical judgment which you will now all the exam in the world. It started to test your clinical judgment rather than the knowledge. The knowledge you can get it under your tips from many applications, from many websites, from everybody
From any book.
smartphone. You can go
Yes.
to that. You can go to Medscape, to NIH, to Cleveland, to Mayo Clinic, to whatever. There is a lot of millions of websites. There is
Fast
a
medicine.
huge knowledge. If you want details, you will swim an ocean of details. But in order to pass the exam, and at the same time, believe me, you will pass the cases in the real practice. Okay? So, for example, yesterday I have a patient, he came to me with a cluster headache. And we don't have the subcutaneous triptan. It's out of stock. The patient is having severe headache. So what kinds of management?
100% oxygen.
100% oxygen. Yes, patient told you, doctor, I am not comfortable with this oxygens, and I cannot sit forward. It's causing for me nausea and vomiting. I don't want.
Okay, so then triptans, you can give sumatriptans, which is subcutaneous, or you can go for oral triptans.
Yes, who are the best? The best is the subcutaneous triptan.
Mm-hmm.
Can I ask you why? Why the best is subcutaneous triptan?
No.
Yeah, because it is fast. And the cluster headache, the headache will come and reach the max.
Yani oral, okay. First pass metabolism and then it will reach, so it will take some time.
The headache will come and abort it. If you give an oral, which you will start after half an hour, yani after the absorption, already the headache will go. The patient will drink all the pain. So give something fast, because the headache will go fast. The patient is suffering. This is a suicide headache. Very, very severe headache. Yani, the patients will tell you, I have a very killing headache.
Yes, then you can give nasal triptan. Did you
Yes,
have
you
nasal?
can give nasal triptan. It is an alternative, but the best is the subcutaneous. And oxygen will apport 90% or 85 to 90% of cases. When this patient, I convince him, we don't have injection, so let us try. We can start the oxygen, and if you are not tolerating, then we can stop. Okay? Oxygen will help a lot. So, the patient ask you, doctor, is there any control preventative medication for the cluster headache?
Yes, verapamil.
Yes, verapamil. So, in this regard, if you want just a knowledge, you can get it. But the question in the exam is squeezing you in a specific point, And you need to answer that specific point the examiners wanted. So the knowledge in the handbook, the knowledge in anywhere, in the websites, Medscape, UpToDate, they will give you a list of 4 or 5, all are correct. In the exam, they will give you these 5, they want the best one.
The best one, yes, doctor.
That is the difficulty in the exam. And in the practice, same, the patient can squeeze you. This one I don't want. So contraception. Doctor, tablets I don't want. Injection, no, I don't want injection. Okay, so let's just give you implant. No, there is implant. I will feel it like in my arm before I. No. So he will squeeze you. He want to squeeze you in the options. Exam is same. Wallahi lazim, every patient in the clinic is a scenario. Every patient in the clinic is a scenario. So the knowledge, you read it in the website like a note. You cannot get benefit unless you face practical case and you go back to the website, for example, UpToDate or whatever, to solve your.
To face clinical oriented patients cases. Yeah, unless and until you face clinically oriented cases, then you will be familiar to the examination. But only just reading the book, it is not useless. For this reason, people they say that John Murtagh book for MCQ1 examination is very good, but no one can correlate from this book in the examination. But if your brain can communicate or can clinically make orientation, then it is very good. But no one can do that. So it is difficult, they say.
Yes, that is why studying through the scenarios is the best.
More better.
To learn.
Yeah.
It's the best way to learn. I don't like handbook. I didn't took a handbook in my hand from 1999. The best way to study is through scenarios. Or a patient and go and read to solve your problem. But in the scenarios, in such kind of MCQs, you will find a scenario that is compatible with the practice. Yes, it is compatible with the exam, so you can get 2 benefits. That is why, and I will close the lecture with this point, ya Jamaa. Don't be disappointed that you study and you didn't get a seat. Your study is investment. You will get benefit from it. Don't be disappointed. Don't feel sorry you read, ya Jamaa. I don't know. Yes, people are waiting for upgrading themselves and improving their careers and having the certificate. But don't, it is not to the level to be disappointed like that. People, they want to change the line, they want to stop, they want to withdraw. This knowledge, you read it because you want to prepare for this exam, will help you a lot. And I will strongly recommend, don't stop. Don't stop whether you get a seat or you didn't get. Whether you will sit for the MRCGB or MRCB or MRChem or whatever, or even if you don't want to sit for exam, don't stop. If not, there is a lot of websites you will find a scenario-based study you can do for your practice. Until you got a seat, you can then come and you will need a very few refresh. Okay? So, I'm sure those who prepare for 1 or 2 times, they will feel better after passing the exam in their practice more than those who pass from the first time or have got a seat from the first time. Because we are not studying unless for exams. Okay.
All right. Thank you so much, Doctor. Doctor, can you tell me that is this MRCGP South Asia, is it acceptable in UAE, Dubai, Sharjah?
Yes. Yes.
And so then why are people doing MRCGP International for Dubai specifically?
No. For Dubai is the same like for Pakistan. We said, the only Dubai is expensive, and they are tough in the requirements.
Okay.
What
And
is the requirement, doctor, for Dubai?
They want 3 years in family medicine or primary care clinic.
okay.
Yes.
Okay.
As well as a fresh 3 years, or if I have previous 3 years, not last 3 years. I have maybe last 6 years.
It should not be remote.
It should not be remote, doctor. I did not understand what you mean.
يعني ما تكون خبرة سنة 1999 أو 2005 وتقول
أيوة.
They want it recent the last 10 years.
Okay. And
last
Dr.
3 years, last 10 years. Okay.
Yes.
Doctor, how will they try to confirm this years of experience? Because in our region, some of the hospitals, they don't use email, etc. So how will they go to periphery and how will they confirm
data flow?
this experience? What?
Data flow. They need to confirm it by the data flow.
What is data flow? I mean, like they can't reach their periphery, their peripheral areas, because that is so far away, and there is no means of.
No. For sitting, no problem. They if you have a certificate, no. I have one colleague. He's working in like a third party. There is giving service to other company, for example, ADNOC or petroleum company. There is one institutes supplying the clinics of that company with doctors. So in the experience, they will say to you, okay, where is this? You got experience from this company. Where is this company? They will search it in the Google, in the internet. They will collect information about it. Even if it is not an official data flow, they will check. If they have any suspicious, they will tell you we need attestation. If it is well-known company, well-known hospital, well-known clinic settings, for example, from Arstar Clinic, from Primary Care Clinic, from Taha, from Saudi MOH, then خلاص you brought the certificate from هيئة خلاص they will primary care clinic family medicine خلاص okay. If you brought it from hospital, they will ask you which job in the hospital, internal medicine, renal, where. If you said I am clinic, they can ask you another cover letter telling specifically you are seeing primary care clinic practice.
Doctor, I understood that point, but I'm just asking you, like, if it is not available, the information is not available in the internet, and it is just a remote part, and there is no email services. Okay, even
not accept.
They will not accept.
Yes.
Okay.
Because I think
try. You can try.
Okay.
دكتور طيب لو ER ولا internal medicine ما مسموح في حق دبي؟
لا.
اوكي.
طب in Pakistan, MRCGP of Pakistan, how many years of experience they need?
5 years, 3 of them general.
Okay, then Dubai is less duration.
3 years, but should be in the family medicine.
Doctor, I don't know about this MRCGP of Pakistan. Can you tell me about it? Is this
South Asia? This is a South Asia exam.
The South Asia. Okay.
Yeah. The office in Pakistan, but the centers may be in Riyadh, in Jeddah, in Colombo, Chennai, like this.
No, I feel like the office is in UK, doctor.
The office in Pakistan.
Are you sure? Because I searched it and the office is in UK.
No, in Pakistan.
Really? Okay.
The office in Pakistan, the numbers you can call in Pakistan, and the server of the website, their website in Pakistan. We located.
Okay.
We give the VPN for the doctors in Saudi to attend to apply fast and easy.
All right. Okay.
Doctor, if I work with a consultant here in Jordan for 5 years in his own clinic, it will be acceptable by them?
If it is official job and you can get official certificate.
No, it is not government. It is private job from a consultant.
Yes, in his
cardiologist
center.
With a cardiologist. If I produce a paper of 5 years experience from a cardiologist that I worked with this cardiologist 5 years.
As per experience of many doctors, I was following them, and they sit. Some of them they sit for exams. Some of them they have been rejected from the exam. If they are not convinced by the company you came from, they will ask you a lot of questions, and they will ask you justification. They will ask you,
or if I provide the data flow of where I have worked.
Yeah, that's it, class.
That's okay.
Yes.
That's okay.
Yes, Doctora.
أيوة. يعني ممكن نقول إنه MRCGP examining skills والبتاع دبي ده memorizing informations أكتر صح؟ حسيت كده.
هو both are examining skills يا جماعة, and that is why we have one lecture before for the skills being tested and the framework. A skill being tested is not a skill of knowledge, is a skill of judgment, clinical judgment, and understanding, not memorizing. طيب. The style of the exam is not like MCQs will squeeze you. طبعا في ناس بيفتكروا انه MEQ is easier because MCQs will squeeze you between 2 or 3 correct. You want the most correct. Am I right?
Yes.
And the MEQ, they will ask you to give us a 4. I think it is easy to some extent. لكن بس الناس they are not used to it. يعني أسهل إنه يقول لك أكتب لي 5 نقاط مما يجيب لك ال5 صح, عايزين مني الأصح واحدة.
أيوة هو أسهل.
it is for some doctors they said it is easy.
أيوة اللي بيحب الحفظ أسهل.
أيوة. If you are memorizing, if you are studying good study, so you can't tell. Now يعني the doctor they answer the questions are very nicely in a tough topic like MS. Now all the doctors they answer it correctly. Okay, all the يعني the doctor. Sorry, I'm very sorry that I'm not following the names, but they answer tough questions in MEQ.
The one who is appeared in Pakistan region as well as in Dubai region, they will be having the same paper.
Yes, same paper.
Same exam.
You mean in Dubai and it is not the same paper, but the same topics and the same style of questions.
Okay.
It is not the same.
Okay, the MCQs paper.
No, it is
the
not
same, both of them.
No. I
different.
I got your point. It is not like the schools, the American or the British schools. exam is not universal. This exam is made by doctors in Dubai and authorized by UK. The South Asia is made by the committee there and authorized by, accepted by UK. So the UK, yes, will accept. Who is the author of the questions? In Dubai are doctors in Muhammad bin Rashid University. And I know some of them. For any section, there is, for every year, there is 1 or 2 doctors who are preparing. For example, if they want 10 questions from cardio, they will ask 3 doctors to prepare, everyone to prepare a 2 set of 10 of questions. For example, you are examiners, they will ask you to author a 2 settings of cardio questions. And another one, they will ask him. So this committee will select the questions. So that is how they are making. Who will make the Muhammad bin Rashid staff? And there in the Pakistan, the committee there. They will set, for example, 180, they will set 3 sets, 3 doubles of the question, and the RCGB, they will choose from that one set. So it is like a long process to avoid cheating, to avoid leak of the exam. So if give you okay, if you now go to our website, there is 4,000 questions. I can guarantee that if you master them, the 4,000, you can get near the format because it is covering the whole topics. They cannot bring questions from outside this syllabus.
يا دكتور، هو مش 5000 يعني، احنا بنتكلم في حاجه تكون لوجيك يعني. ممكن نتكلم مثلا ب 6000 بالنسبه له وياخد كوميشن، مفيش مشاكل يعني. ويبقى في مثلا نشوف ايه، انا زي ما انا قلت لك، هو هيفيدني بايه يعني، هيفيدني بايه وياخد من اللي هيفيد فيه، ما عنديش مشكله.
كيف؟
سيبها نفسها من 5 و6 و9 و10 و15، لكن انا بتكلم في الجزئيه دي. والله انا هقدر اقدم لك ايه وهاخد ايه، طالما هو عنده عملاء وعنده يبقى هو يقدر يحدد الليميت اللي يقدر عليه، وهنا نقدر ان احنا نفيد ونستفيد بس.
Doctor, thank you so much.
طيب يا دكتور، يعني الريسورس بتاع دبي وبتاع ساوث ايشيا واحد،
سيم كوبي بيست،
يعني سواء من الميديكس او من الباس ميديسين ينف يعني للاثنين.
For example يا جماعه، the demyelination disorders. The demyelination disorders, the topics that is authorized for MRCGB is a multiple sclerosis, the neuromyelitis optica. For the peripheral nerves, the Guillain-Barré and CIDP. Okay, there is about another central nervous system demyelination disorders. There is another peripheral nervous system demyelination disorders. They are not for us. Okay. For example, there is how many central nervous system other than the CN, other than the multiple sclerosis, and other than multiple sclerosis and and the neuromyelitis optica. There is a lot of. There is tons of demyelination disorders, but it is not for us. Maybe for neurologists, maybe for internal medicines, some specialties, maybe for MRCP medicines. Yani, for example, the MOG antibodies associated disease, the acute disseminated bad encephalitis, clinical isolated syndrome, CIS, transverse myelitis for medicine, but not for MRCGB, progressive multifocal leukoencephalopathy. All these are demyelination disorders in the CNS. But for us, is the exam in 99% and all the recalls of the previous exam is for MS or neuromyelitis optica. So we are not wasting our time in studying all this. If we want to study the neuro system, by this way, we can take 3 months. We will not finish the neuro. But because of numerical study, we need the most common, the one expected to come in the exam. So we can concentrate on that. We can spend and invest our time in that one.
And doctor, hello.
Yes.
Thank you so much for your session. It was quite helpful, and we learned some very new things. So thank you so much. I will have to leave, but I just wanted to thank you.
Thank you so much for your thanking. We are
Okay.
really very happy that you are here and people get benefits. And at least they will get out of this disappointment. And at least they will have plan B and plan C, and while waiting for plan A.
Inshallah.
We don't say withdraw it, but you can invest. You can get can have a plan B. You can finish one membership while waiting for the MRCP or MRCGB. So you can do something, and don't disappoint it. Even if you didn't get a seat in Jama'ah, you got a knowledge. You got a best practice. You will be comfortable in your practice, and sooner or later, you will get a seat. When you get a seat, you will be ready for exam. Many online, they contact me personally. They got a seat and now they are shivering. Doctor, we got a seat, but we are not ready. How we can do, what I will do for them? If you are not ready and if you have no time, you have a social life, you have a family, you have, and you got the seat, but you are not ready. What is the benefit of the seat?
True. I got the seat, by the way. Doctor, when will they ask for the payment? Yeah, thank you.
There is many doctors got the seat. All the best, inshallah. You will pass. Yeah, you did very well, and I'm sure you answered very tough questions. You are ready for the exam, inshallah.
Thank you, doctor. Can you tell me, doctor, when will they ask for the payment?
I think they will send email. Usually it will take like 2 or 3 weeks, maximum 4 weeks.
Okay, I see. Thank you so much, doctor. Thank you. May Allah bless you. Thank you.
Thank you, buddy. See you, inshallah, next session. For our course group, inshallah, we'll do case study session to discuss multiple sclerosis and the demyelination disorders and answer the question in the question bank, inshallah. See you, everybody.
Doctor, excuse me.
Thank you, doctor.
Send us, if you please, the website, your website on the group.
Sure, inshallah.
Thank you very much, doctor. Thanks.
Welcome.
Thank you for your doctor.
Thank you for attendance, doctors. I'm very happy to meet you here, although we delayed because of some reasons, but alhamdulillah, we did what you deserve from us to do. You deserve more, inshallah. We'll do our best in the website, in the lectures, in the open sessions, in the crash course. We will be in touch, inshallah. See you all.